Hello, thanks for joining us again for another interview with the doc with Ivy Rehab. Today we have with us Dr. Mark Harary from Orthopedic Associates of Long Island. He's going to tell you a little bit about himself, and then we are going to discuss the use of shockwave treatment. Dr. Harary, tell us a little bit about yourself.
Thanks, Carrie. Thanks for having me. So my name is Dr. Mark Harary. I'm a primary care sports medicine physician with Orthopedic Associates Long Island. So I specialize in non-surgical treatments of different musculoskeletal injuries, a lot of concussion management, fracture management, sprains, strains, arthritis, try to manage them non-surgically.
Excellent. So there's this new cool thing out called Shockwave Therapy. What exactly is Shockwave Therapy?
So shockwave therapy uses acoustic pulse waves to treat irritated, damaged tissue to try to regenerate the tissue and promote healing. It actually, interestingly, the treatment's been around for a long time. It started out as a treatment for kidney stones, and somehow, as things evolve, as they usually do, it found its way into musculoskeletal medicine.
Okay.
And we can treat a wide variety of conditions.
So speaking of that, what kind of conditions is it beneficial for? I know you said musculoskeletal. Is it more acute injuries, more chronic? What do you usually typically incorporate it with?
Good question. It's more chronic injuries. So the thing that people usually associate it with is plantar fasciitis. You see that a lot. Also Achilles tendinopathies, tennis elbow, patellar tendonitis, patellar tendinopathy, trigger points. So a lot of chronic muscle injury. It's been used to treat neuromas or nerve inflammation as well. So there's a wide variety of indications. Doesn't really have much of a use for acute injuries. So if someone sprains their ankle, shockwave is not really the right treatment, to get them back quicker. But for more chronic issues, it actually can be very helpful treatment.
Excellent. So as far as contraindications, what are some of those contraindications going to be then?
Yep. So there's not too many, but if someone has a history of malignancy or cancer, you want to avoid that treatment. If someone has a history of blood clots, and if someone has a pacemaker, those are generally things you want to avoid. If you're treating that particular area and someone has some hardware from a previous fracture, that's also kind of generally an area that you want to avoid.
I gotcha. So if you're going to do shockwave therapy on somebody, what's the standard, or how would you explain to a patient what it's going to feel like both during the treatment and then also afterwards?
Yeah. So it's not a painful treatment at all. The device, it's a machine that sits in our office. The machine is about that big, and it has a trigger handle. And attached to the trigger handle is the adapter that essentially performs a treatment. So depending on the area that we're treating, we can use different adapters. It feels like kind of like a vibration, a strong vibration during the treatment. Sometimes it be a little mildly uncomfortable. When we first got the machine, I actually tried it on myself. I have tennis elbow, and I had my athletic trainer do some treatments on me. So it kind of gives me a good idea what to expect and how my pain tolerance compares to some of my patients too. But it's not painful. It can be a little bit sore after the first treatment or two. With it, typically the treatments, they'll last about 5 to 10 minutes per session, depending on how big the area is that you're treating. Also, I tell patients, don't expect to feel better right away.
Okay.
Usually it takes at least a couple of treatment sessions before you notice some improvement.
So how frequently do you do the treatments?
So once a week is what we recommend. And generally we recommend at least 3 to 4 treatments to get any significant benefit. You're not really going to get benefit from one singular treatment. You want to do a series of treatments to really help to break up irritated tissue. Usually around 3 to 4 for things that have been going on longer. It might take more treatments, up to sometimes 5 or 6 or more with it, but generally most things can be 3 to 4 treatments.
Now, while you're doing these treatments, so you're doing the shockwave treatment about once a week, do you incorporate it in conjunction with something like physical therapy? Can patients continue to do their regular daily activities or even, whatever their standard athletic activities are during the course of the treatment?
So yeah, we generally have few restrictions with it. We want patients to be off of anti-inflammatory medications during the treatment because that can inhibit the healing process. But in general, patients, athletes, they can do a lot of their normal activities. I find it better if they're doing the treatment in the off season for a quicker response with it. But it is something that can be done in season and still be beneficial. And as far as rehab, absolutely. Anytime you're treating an injured area, you want to strengthen not just that area, but you want to strengthen the areas around it. A lot of times these injuries that we're treating, they're chronic injuries. They don't happen overnight, and a lot of times they happen because of weaknesses in other areas or deficits in strength in surrounding joints. So, for example, in someone with tennis elbow, they're probably going to have a poor posture, poor shoulder muscle control, and you want to make sure that you're treating those areas, with physical therapy in order to maximize the benefit that you're getting and also prevent further injury down the road. So rehab is definitely a big part in helping make sure that this treatment is as successful as possible.
Excellent. Now, another question. Does this typically get covered by insurances?
No, unfortunately, as of right now, this it is an out-of-pocket expense. In, Insurances right now are not covering it. They typically, it takes a long time for insurances to come around to new treatments and to cover them. So right now, this is out of pocket. It does tend to be less expensive than other regenerative medicine options like PRP and stem cell treatments, but it is an out of pocket.
You read my mind. So PRP or stem cell versus the shockwave therapy sounds like cost might be one of the differentiating factors. Are there other reasons that you would recommend shockwave therapy over PRP?
Yes, so PRP has some other contraindications, like other blood disorders. They that might prevent someone from doing PRP. Cost might be a factor. Also, this could be done in conjunction with those other treatments. They're starting to do studies on treating patients with PRP and then shockwave treatment, or shockwave treatment and then PRP, to see how they respond to it.
Mhm.
So it's not always an either or type situation. Um, Shockwave, the benefit of that is there's no needles involved. It's non-invasive, so patients a lot of times like that. But it could be done in conjunction with other treatments as well.
Excellent. So if there were just a couple of key pearls that you would put as far as shockwave therapy, what's your best candidate for this particular treatment? Who's going to have
I
the
was
best outcomes?
I would say the best candidate is someone who has had pain for at least a few months in an area that has signs of tendinopathy either on ultrasound or MRI imaging, and they've tried and failed some conservative treatment, either home exercises or physical therapy. Those are kind of the ideal patients that would benefit from chocolate.
Okay, great. And if a patient wanted to try to get in and see you, remind me, which offices are you in again?
So our main office is in East Setauket, and that's where we do the treatments. I do see patients in some of our satellites. I go to our Comac office, our West Babylon office, and Wading River as well. Patients can see me in any of those offices, but the treatments there only done in East Setauket office. That's where we.
Okay, great. Well, thanks again so much for the information, Dr. Harary. It's good to hear about these new alternative options that patients have, or existing alternative options that are finding new guidance as far as being able to manage some of these ongoing issues. Thanks again, and we appreciate you taking the time.
Thank you, Carrie. Thanks for having me.
Have a great one.
Bye bye.